all right, we're going to go to telehealth and we're going to start losing, I don't know, $30 a visit, $40 a visit. Are we going to be able to make that work? And does that work for increasing access, improving quality, and those kind of things? So we have to put metrics around those things to make sure that what we're doing is not impacting the quality of care, obviously,
Right.
and it's increasing access. There's no question that it does increase access. In fact, there's an article I covered on Today in Health IT last week, which said, in fact, it is driving overutilization in that people are, once they realize how convenient it is, they're more prone to call in. But this shouldn't be a bad thing, right, for us. We want more touch points with,
Yeah.
especially chronic patients, but people calling in saying, "Hey, I've got this." We want to avoid ED visits and whatnot. This is, and he even says it in here. This is sort of tricky. What's the hybrid? What's the balance? Do you have a comment there?
In terms of the balance, I'm going to bleed into the other article that we shared on bricks and mortar. I think that's where there was the example of,
Yeah.
of a mother who has had 60, what'd she say, over a period of time, 60 specialist visits
Yeah.
for her child who's got significant medical issues. And how often does she have to drag her? How often does she have to go in physically with her
Yeah.
child for those visits versus the telehealth? So I just go back to convenience and finding the right balance. And the other thing is, as I'm sure you've seen in metropolitan areas that you're in, I can say it here in New England and specifically around Boston, a push to build out new ambulatory centers in the surrounding towns and suburbs so that you're not driving in to the heart of Boston and all the traffic hassle. So you take that one step further, you're making care accessible there. One step further, what can be telehealth visit instead of coming even into one of those satellite centers?
Yeah, and it's interesting to me because United Healthcare did this retroactive look at ED visits, and they were going to deny claims based on the criticality of the nature of the care. But the reality is, some people have been trained to go to the ED, and I think it was New York Presbyterian. In fact, I'm sure it was New York Presbyterian. Daniel Barchi talked about this on the talk, and he said they actually created a pilot where they had one door went to the ED, and then the other door went to a telehealth visit, essentially. So they could get triaged before, or they could even be sent from the ED over to that, saying, "Hey, look, you could do this over here. It's just a lot better experience." And I don't remember all the details, but the cost on one side was almost like 7 to 10 times the amount as the cost on the other side. I never really understood that. It's in the same building. It's because you're seeing your primary care doctor instead of seeing an emergency visit kicks off a lot of
Yep.
things, and there's a lot of infrastructure to support that. I get that from that perspective, but that's why we need more ambulatory surgery centers. It's also why we need a very clear message, I think, to our communities that says, look, start your visit here. Unless you're bleeding and those kind of things, start it here. Start a conversation with this doctor via telehealth. In fact, my insurance carrier, I don't have it in front of me now, but my insurance carrier sent me a thing that said, start all your engagements with your healthcare system through Teledoc, offered through my insurance carrier. It's really not a bad model because you don't want me self-diagnosing. I can't diagnose myself. And it's great to have a trained medical professional on the other line of the phone who can potentially do what, 20, 25, 30 visits an hour, really, if depending on how long the calls go.
So I'm curious. So in that plan, is that it's through Teledoc? Is the provider you're actually talking to part of the health system that you would ultimately go to? That your PCP is
No,
connected?
actually, I don't think they would be.
Okay. All right. So this is where I'm not familiar with how all these telehealth companies are working from a model perspective, but provider organizations want you in their system, right? And they want you to enter in their system. So if there's the partnership between those telehealth companies and the provider system, the health system, so that it's a smooth transition, maybe a front end triage, right, to a provider, and then you get to someone in your system.